Let me just kind of draw you out a little bit on the proposed protections that you are advocating for here. So first of all, I just want to be clear on the cohort that you are describing for us. So you are suggesting that participants who receive 24/7 supports are carved out from ministerial support determination. So for those participants, any ministerial support determination made would not apply. Is that right?
I'm happy to jump in first. Yes, Senator, that is correct. What we're saying is, we've seen the government in their explanatory memorandum, including the wording that they say people with 24/7 supports and critical supports are not intended to be affected. What we're saying is that it's unclear if this legislation goes ahead what that mechanism will be. We do think it needs to be an explicit carve-out, people who need 24/7 supports. And that's mainly due to the complexities of the interactions of supports that I explained in the opening statement.
Yep. Okay. And to be clear, when you say to us 24/7 supports, are you talking about people who receive and require the support of a support worker or workers, like all day and all night, or are you referring to 24/7 supports as it is defined by the government and the agency, which is a duration of support worker hours greater than 8 hours, I believe it is at the moment?
Yeah, it's the latter, Senator. A duration of support work hours of greater than 8, some form of overnight support as well, and that high intensity types of supports that are required.
Okay, so they would be exempt from the ministerial support determinations, and that would mean that the 50% cut to social and community participation, for example, or the 10% cut to capacity building, or any other cut made via a support determination, or a determination in relation to pricing or maximum expenditure for a type of support wouldn't apply. Is that what you are proposing?
That's right, Senator, and you correctly picked up on the fact that this is not just the support determinations in relation to SECP and capacity building. We anticipate they would also imply in the event that caps to funding or ratios, etc., were implemented.
Okay, thank you. I think you've given us a really clear picture of what you are proposing to us. Can you just explain in as a kind of accessible way as possible the risks to the participants that you represent as organisations of the legislation in its current form without the changes that you're proposing? I might go to Ms. Kennedy and then work from there.
Thank you, Senator. So to take, for example, just one area, the support determination and the social, community and civic participation funding reductions, for people with an intellectual disability, who we are all here to talk about, SCCP supports are much more than social activities. They're very important preventative supports that help people stay safe, healthy, independent, connected to their community, and for many, as Michael said, able to work. So these supports are what many people need to, for example, be prompted to take medication, prepare meals, attend medical appointments, develop routines, build relationships, travel safely, and maintain their informal support networks. They often prevent crises and reduce the need for more intensive supports later. They're fundamental for people living ordinary lives in their communities. So cuts to social and community participation will lead to greater isolation. We know from the Disability Royal Commission that isolation is a very unsafe condition for people to live in, that access to community is vital for safety. There are really significant risks when people don't have access to support workers, when there are not eyes on people. So some of the earlier evidence that you heard today as well is about safety being visibility. The more people are in someone's life, the more people who know somebody, the more safeguards there are. If something does happen, the more people who will pick that up. So not only are we reducing those aspects, but the proposed legislation will actually take away the funding that contributes to some of those active supports, leading to conditions like people not getting preventive health care, conditions worsening, not making healthy choices with eating. You know, a lot of people, conditions will get worse, which will lead to flow-on costs for other healthcare systems. And as the other witnesses have said today, also really significant impacts for family members as well.
Okay, thank you. And for people with Down syndrome, for example, there would be additional risks, Mr. Steff, to that community specifically.
I think a lot of similar risks, Senator. But I think just to expand on a couple of things that Maeve touched on there, I think around the some of the supports that might sound relatively routine, like assisting someone to go shopping. Now, that shopping might be, that assistance might be the assistance that helps them make healthy choices about what they're buying, that then prevents other broader health issues that impact their disability.
Yeah.
And I think the other thing to touch on there is, or to emphasise that was mentioned, is the importance of the employment supports. And we do note the amendment that was put up, and thank the Greens for their work in that around employment supports. But we're keen to emphasise that needs to be all supports that enable people to obtain, maintain and succeed in employment. As you're aware, people will use employment supports very differently, and we need to make sure that they are all included in that carve-out so that people are not impacted by these cuts. Absolutely.
Okay, so you've made for us a very compelling case for the amendment that you are proposing and the risks if it isn't actioned. Have you had any success in your conversations with the government around these amendments?
Look, I think, as we mentioned in the opening statement, we welcome some of the changes that we've seen and have been mentioned in the explanatory memorandum, but we don't feel that they go far enough at the moment. And particularly if we were to talk about the escalation pathway, we see that good safeguarding needs to be proactive. It needs to identify the risks early, coordinate the right response and prevent people from falling into crisis. And therefore the wording that has been included in the explanatory memorandum, we don't feel goes far enough to define what that safeguarding and escalation process needs to be. And we are asking for a two-pronged approach, essentially, a systemic preemptive pathway that, and we'd like to see that the NDIA have a clear legal responsibility to escalate concerns when support arrangements could become unsafe, not simply respond after serious harm has occurred. And then we think there also needs to be an individual mechanism where, there are people whose supports have been impacted and they are now currently at risk of harm. But I'm not sure if Karen, you want to add anything else to that, or Maeve?
Yeah, I might add, if that's okay, and then obviously defer to Maeve. I think we've been encouraged by the discussions that we've had with government. We believe that they understand the issue and the significance of the issue. We think that we're both wanting the same outcome. However, we remain convinced, and our collective experience tells us that for people with 24/7 support needs, the only way to ensure that they continue, that their supports are continuous, that there's no impact on their 24/7 support needs, that they're not left with gaps in their supports, is that they do not have the support determinations, and particularly the support community participation reductions applied to them. We think that's the only way to do that safely. I guess what I would add is that, Maeve and Daryl have done a really fantastic job about talking about the impacts on the groups that they represent. What we see particularly from our members and what we hear is that for people who require 24/7, where they receive that in a supported independent living environment, for example, those supports are quite complex. They're made up in different ways. Often those environments are, they're shared households. So what happens for one person really impacts everybody else that they're sharing their household with. So the example where the 24-hour support that people are requiring might be made up of 16 hours of support that's funded in the home, but that other 8 hours is made up through those community participation supports. So if they're cut by 50%, that leaves a gap. And in our experience and what our members tell us is that providers are often picking up or are concerned about needing to pick up that gap in an unfunded way. We also hear reports building on what Maeve and Daryl are talking about is, where support needs are not met, where health conditions are not supported, where people aren't supported for that preventative health care or even more significant issues, that we anticipate that those individuals may end up actually in the hospital system and in our other systems. And we think that, in terms of sustainability of the NDIS and good outcomes, preventing that and acting really proactively, is a really, really important way of continuing and contributing to sustainability as well.
Okay, thank you. Look, we are a little bit pushed for time, and I would very much welcome you to provide us with any additional information you would like to around these amendments that you are proposing, noting, of course, that there's a deadline for that feedback. Just finally, we've heard evidence about the new proposed functional capacity assessment. We took evidence yesterday from a range of allied health professionals who shared with us their concerns. It seems that this functional capacity as legislated, this assessment as legislated, will explicitly not take into account your broader circumstances, your environmental circumstances, the context in which you live, in a way that no functional capacity assessment to this point yet in use has kind of done. Are you concerned about what the implementation of this functional capacity assessment could mean for the groups that you represent?
Senator Maeve speaking from Inclusion Australia. Yes, broadly is the short answer. The long answer is it is another part of the bill that we just do not have enough information about implementation yet. And while there are assurances that this won't have that there's no intention to cause negative consequences to people, we are worried about that. We would encourage the use of validated tools, including the World Health Organization, ICF, which really does see environmental considerations and contextual considerations as an inherent part and not able to be separated out.
Okay, thank you. And I'm assuming that if these amendments, we're considering a piece of legislation right now that doesn't have these amendments included, and so your position would be that the bill in its current form shouldn't proceed, correct?
Correct, that's our position.
Is that the same for DSA and NDS?
Same for us, Senator. We support reasonable reform to improve the NDIS, but these current legislation does not come with appropriate safeguards, so no, in its current form we do not support it.
Same for NDS.
Thank you very much, and once again for your clarity and advocacy in this space. Appreciate it. Thank you. Thanks, Chair.